Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Recently, Dr. Jay Varma, who advised New York Mayor Bill de Blasio on the pandemic response, penned a piece for The Atlantic called "Not Every Question Has a Scientific Answer." In the article, Dr. Varma talks about the critical role of politicians in determining difficult COVID-19 policy questions. When it comes to closing restaurants and schools, there's more to it than just following the science. In this special bonus episode, Dr. Josh Sharfstein calls Dr. Varma to talk about his take. Let's listen.
Jay Varma, it is great to see you. Thanks for joining me again on the podcast.
Great. Thank you, Josh, for having me.
So I think I'd like just to start by reminding our listeners all the work you've done in New York and what you're doing now.
Sure. Yeah. Thank you very much for having me. So, Josh, I'm a physician and epidemiologist who spent the past 20 years working on infectious disease control issues, both domestically and globally. In April of 2020, I was based actually at the African Union, helping guide the African continent's response to COVID, but got a request specifically from the mayor of New York City and his team to return to New York and help lead the city's response in the wake of the really deadly first wave of the epidemic. So from April 2020 for another year, I served as the mayor's senior advisor, guiding the city's COVID response and serving as the chief scientific spokesperson for the city.
And I know that during that period, you were deeply involved in a number of different issues, including the huge contact tracing effort in New York, all the work around schools. What were some of the high points for you?
Yeah, the most important task I had when I first arrived was building a community testing program and then our contact tracing, quarantine, and isolation programs as well, which have been really some of the largest in the United States. I think we just passed the 1 million mark in terms of people who are contacts who we've actually reached out to and provided support to, as well as one of the largest testing programs in the city. But probably the most important thing I was involved with on a day-to-day basis was really intense policy discussions about all of the challenges that COVID presents to us. Schools is probably the most thorny of all of those problems. And I played a very active role in designing the health and safety protocols that allowed us to reopen the largest school district in the country in 2020. And then, of course, was involved in many of the decisions we had to place about local restrictions on occupancy, and more recently on our decision to implement a vaccine requirement for anybody participating in indoor dining, fitness, or entertainment.
So that's a lot of policy decisions in a short period of time.
Well, COVID has, as we all know, has rapidly accelerated the new scientific information, but even more challenging how we translate that scientific information into policy that has really immediate impacts, not just on people's lives, but of course on their livelihoods as well.
So now that you have stepped down from your position with the city and you're at Cornell, you've had a chance to reflect on this policy process and the trade-offs that are involved.
Yeah, I think, during my time in government, we're obviously somewhat restricted in how much we can talk about internal deliberations. So one of the issues that continuously that I found continuously frustrating was following discussions in the media or online in which there seemed to be this very strong belief that if we simply take scientific information and follow that through to its natural end, then all will be well. And one of the things you get very accustomed to when you've done any type of government public health service is knowing that every decision that we make on policy has to account for many, many factors for which science does not actually have an answer. And in those situations, if you believe in democracy and the rule of law like I do, you have to say that we're going to start with the science. but that we may not be able to follow it through because we have to balance the competing interests of many people who may not be willing to make the trade-offs that a strictly science-based approach would require you to make.
So you are kind of rethinking the slogan, follow the science.
I think we really do have to rethink that. And there are challenges with rethinking that, and I think we can talk about those later. I mean, it's particularly challenging, obviously, in a world where people can't agree on a common set of facts. And so I'm starting from a point which may be a little idealistic, but I do think is very much informed by my own experience, which is that if our team of health experts in the city would be in constant discussion, myself, the health commissioner, the head of our health and hospital system, constantly reviewing information and arriving at our own consensus of what we think science says. And then when we had policy discussions with the leadership in the city and directly with the mayor, we would always start from the point that, okay, if our agreement is that the only thing we want to focus on is saving lives and preventing infections, this is what the science would say. So in some situations, for example, that might be we need to continue business restrictions or stay-at-home orders for a much longer period. But then the next step that comes after that is the much more complicated process of understanding benefits and harms, and also answering those tricky questions: who benefits, how much do they benefit, and who is harmed and how much do they harm? And it becomes particularly challenging when it's quite easy to measure the harms of COVID, illnesses, hospitalizations, death. But it can be much more challenging to measure harms when there are no strict numbers you can latch onto.
So in your mind, you have the science informing a recommendation from health officials on how to proceed as safely as possible, and then a discussion with political leaders about really balancing that with other issues that may be important to them. How do you hope that conversation goes? Like, what's an ideal way for that conversation to go? What data do you need? What transparency do you need? But, to go from maybe a health recommendation into a true plan for a city.
Yeah, I think now there are a number of challenges to doing this. So one is sort of, what is the cognitive process? But the second is, what is the persuasive approach? And some of them may not be always aligned, of course. And I think, but I do think that if you follow a very strict cognitive process, you can also make a persuasive argument. And so, what do I mean by that? I think far and away, one of the most important lessons that I learned in commuting with a lot of high-level officials in the city, either they, the people in the executive branch and the mayor, but in legislatures and other places, has always been that you as a scientist have to be very honest about what you know and what you don't know. But even more on top of that, you have to acknowledge your biases. So I would always start discussions by saying my bias, as a public health person, is to prevent as many infections and save as many lives as possible. So that's why I think this is the approach that's necessary. But then I would go on to be very clear about saying, I recognize that by doing this policy, this group will be harmed. So let's say, for example, we wanted to close indoor dining, which is something that we had to keep closed even after the original descent of the first wave, and that we had to reinstitute back in the winter during the second wave. We have to be very clear and acknowledge to policymakers that we understand that creates economic harm and the loss of jobs and entertainment for people. And I think by being very honest about that in those policy discussions, you can get to a point where your final recommendation is science-based, but it may not be 100% of what you necessarily would have said if your only priority was preventing COVID infections and saving lives from COVID.
Well, let's take that as an example, closing restaurants for indoor dining. A lot of strong evidence that was a place for spread. Right. And both biological evidence and then over time, epidemiological evidence that it would be safer not to have indoor dining, going back to, the early months of the pandemic, particularly. On the other hand, clearly there are economic ramifications. You can imagine a process where not only are you talking about the trade-offs, but you're talking about how to manage the trade-offs. For example, that could be a discussion that leads to more resources for restaurants to support the harm that would come to the people who work there. That I can understand. How do you, think through a process where people say, like, look, we're just not going to accept any economic harm here, and we just can't do it, even rather than an approach where you're kind of trying to work out a solution with policymakers. I think some people would say, like, if you present this and people just say no, well, then that's clearly not following the science. How do you handle that kind of situation, which was the case in many places?
No, I absolutely you recognize that, and I do think that the most important thing, at least I have always found, is, well, first of all, I have to be very clear. I don't feel that health officials, even people who have had high level leadership positions like myself, are necessarily always best positioned to analyze all of those trade-offs and understand them. We live in a diverse society where people have strong competing interests. And unless I can guarantee that I'm also going to be able to mitigate those harms, somebody has to be in a position where they are given the authority to make those decisions. And that's why we have democracy. Now, of course, we run into a major challenge when, again, I'll repeat, kind of the point we made earlier, which is that if your executive that you're presenting to does not agree on the set of facts, then I think you are in a much more difficult and tricky position. But if you are in a position where everybody can at least agree on the facts, you then are really getting into that question about what is the level of harm that, let's say economic harm that somebody is willing to take on behalf of society. And unfortunately, nobody can answer that question for everybody, but somebody has to. And that ends up being the process of democracy.
Right. I mean, I guess where I struggle with this point, which I fundamentally agree with you. I think I certainly agree that ultimately it's a democratic process that decides what to do, is that I didn't see, even in the places that made decisions, for example, to keep restaurants open for indoor dining, a thoughtful kind of conclusion, which might be, look, we realize we're making this worse for the pandemic. We realize the consequences could be 10% more infections and down the line hospitalizations and deaths. But we believe that we need to pay that price because of the economic harm. Instead, people said, the evidence isn't that good, that there's anything to do with indoor dining. People can wear a mask, maybe, and that might be the kind way of putting it. Other places, it was like, this whole thing is a hoax. We shouldn't really be focused on worrying about the virus at this point, and we all should have our freedom, in the sense that, like, there's really no consequence from it. So, was there any place that did a process like the ideal process where people are recognizing the trade-offs?
I mean, I do think that people have been doing that in places like New York and California and, Washington State and Massachusetts. A lot of the states that I think have, after that initial wave, have handled this, I think have done that process well. I do think one of the missing pieces, however, is the one you touched on. Can elected officials be openly honest about the trade-offs that they're willing to make and not willing to make? So, for example, I've seen a lot of discourse either in op-ed pieces or on social media from a lot of health experts saying that, why aren't elected officials being much more clear about what their endpoints are and what their targets are for moving and replacing restrictions? And I can tell you very honestly from the inside, these are discussions that we have all the time. But no elected official is willing to come up front and say, I'm willing to tolerate, let's say, 10 deaths a day or 500 deaths a year for us to get to this point. Because they know the moment that they make that statement, it can be turned around on itself. So this is a very challenging process. I agree with you completely, where I do think elected officials need to be honest that they're making a trade-off, for example, in the indoor dining example, but they are going to be limited necessarily in their ability to be as fully honest about what level of infection and death they're willing to tolerate. Because the right answer, of course, from a public safety perspective is we want nothing. But a world of zero exposure and zero risk comes with also extreme costs that many of us are willing to take.
Right. But wouldn't the fully transparent answer be, I recognize this may cause, estimated X number of illnesses and deaths, but I'm also anticipating it's going to have some benefits in a different way. And I believe those benefits outweigh those costs. I mean, you
exactly
wouldn't expect someone just to say what the cost is, but to really articulate the benefits and explain that. But I think, as you point out, that's a very hard place to get to. So you're left with, I think people may be hoping that they are not making that trade-off, or sort of expressing the idea that there's no trade-off to be made. And that's where you get the frustration that people aren't following the science, perhaps.
I guess I think what's challenging to me is not so much maybe the restaurant example, where I do think that there's a the actual approach to mitigating the economic harm is fairly straightforward. Maybe not easy, but it's straightforward, which is that you provide economic support to mitigate that loss. But let's think about the much more complex and wicked problem of schools. I frequently have found myself just in the crossfire between two extremes. Extreme groups that say schools should be open no matter what, don't bother testing for COVID, have no restrictions, everything should just be open. And another group which effectively believes that, we should continue remote schooling, and essentially there should be no in-person school until the risk is as close to zero as possible. And what's been incredibly challenging in those situations is people just simply not acknowledging the harms that come in either direction. I think the harms of infections are we now understand those a lot better. And again, like I said, they're much more easy to measure. But what's very troubling is the fact that we really have no quantitative, real-time metric to evaluate the social, emotional, physical, and other health-related harms from kids being in staying at home and not going to school. And so this is where it becomes, I think, much more tricky, where you have to be clear that you are making trade-offs, but people on either side of those debates also have to be honest about what they're measuring and what they're not measuring.
So I totally understand where you're coming from. And I think it is sort of the restaurant example on steroids, in a sense, that you have a clear situation where you're trying to balance certain things, but it's very hard to talk about that balance because you have groups of people who see one set of values as totally dominant over the others. The most important thing is that there is no teacher who could be exposed to risk. And on the other hand, the most important thing is that every child gets to go to school as much as possible. And if you're coming from that perspective, it's very hard to see the fact that you're trying to find your way through this and balance the really important views that people have and values that people have on both sides.
Yeah, and I do think that this is where, having both the public health sector, and the health expert, the health commentariat, the people making recommendations, they have to be very clear, because very often, we would get press inquiries about, well, this expert says you should be doing this. And it's not as if we haven't already considered it. I would say 99% of the time, these are things we had already thought through and may have wanted to do, but because of the costs or the operations or the political implications or the feasibility and acceptability in certain groups, you just weren't able to do something. And that's where, this is very tricky, as you know, from having served in, many times in different government roles. You have to recognize the fact that you are not the elected official. So you have to be willing to take a stand where your expertise lies, but also be willing to, unfortunately, make compromises as a result of this, very challenging process. And I never would profess to anybody that it's simple at all. There are many times I would come home and rant to my wife about, I cannot believe we were not able to get this done. But at the end of the day, I have to sort of just say, okay, well, my role as an expert is to inform the policy and to make sure it is as evidence-based as possible. But unless I'm an elected official, I'm really not the right person always to make all the right trade-offs.
Yeah, I don't disagree. I just point out some of your frustration may be that when it's not all that transparent to people, people may assume things about the process and how it's worked. And people are reluctant to be transparent. Even as you pointed out, they're reluctant to be transparent about restaurants, let alone about something where people have so many strongly held views like schools.
Yeah, I think I'm not naive enough to believe that that this is going to change dramatically for elected officials. Having spent enough time in government service and seeing the sort of the tension between how media cover stories and how elected officials want to play the media off. But I guess what I would really be most eager for, and what I would hope would be an evolution, is to have more honest discussion of these on television, on radio, and podcasts and other places, where health experts are asked to also explain what the trade-offs are in what they're recommending. And conversely, when non-health experts are opining about COVID policies, maybe they're legislators being interviewed on shows, that they also be forced to acknowledge what set of facts they're starting from, and why they're coming to their recommendations. And I think the extent to which we can increase the level of sophistication of discourse about these issues, as opposed to there's science on one side and politics on the other, but really recognizing, as all of us in public health have known, people have known this for millennia, that, all health is politically constructed in some way. But to the extent that we can make those discussions more honest in public discourse, I think we'll be better off. Whether we can get elected officials to do the same, I think is a much taller task.
What I'm wondering is, if our goal is to have a conversation, not just with policymakers, but also the public about what the real trade-offs are, a more sophisticated conversation, a more complex conversation, like you said, is there a level of transparency that public health officials can bring to that process that makes it easier for everyone to have that more, complex conversation, so that people are looking at the data about the trade-offs, and policymakers have to respond to both sides. And it's not just that it's a kind of a backroom conversation and, you go home and you're frustrated with your wife.
Yeah, I think, Josh, you're hitting on, I think, one of the biggest challenges that public health officials have faced here in the United States and elsewhere. And it's one of the many contributors to why there are so many leadership positions that are vacant, because people have left in frustration or been fired because of disputes. I think public health officials who report to an executive are necessarily hamstrung in how transparent they can be, because the more they acknowledge the trade-offs that were made, the more they get criticized either by health experts or others in the media for politicizing your recommendation. And even if we can have a sophisticated conversation on this podcast about health is politically constructed, you are restrained. So what is one tactic that you can do? If I had to give a recommendation, I would learn from our experience, which is use data to your benefit. The more data you can make publicly available about COVID and other health-related indicators, the more likely you are to get plenty of, civil society understanding, at least as it relates to the side of we must control COVID at all costs, because that's always there too. So that's one critical thing that you can do, is get that data out there so that there is the pressure from the outside onto your executive about controlling COVID. And then in terms of the trade-offs you're willing to make, however, I think those are much trickier for an elected, for a health commissioner or secretary of health to make openly. But I think on the side of pushing for COVID control as your highest priority, I think the more you can get data publicly available, the more you can increase the external pressure on the executive to hear that side of the argument.
Right. I mean, I agree with you. I would just add that in many cases, health officials are very much thinking about the trade-offs. I think the school example is a good one, because there's so many important health issues with kids going back to school, and it's so important for kids to be in school. And so in theory, that is a consideration that public health officials can have data about too. I don't think I would agree with you and just say it's also the case that public health officials could make data about some of the consequences of certain policies available and be able to make a recommendation that is balancing some of the different health issues at stake.
Yeah, I think this has been definitely a major challenge for public health, and something that needs to be considered for future health emergencies, is actually having dedicated teams that can look at the downstream effects of policy recommendations and issues that are made. I mean, for example, in New York, we did look at issues like increases in mental health crises and emergencies, and in suicide, specifically suicide rates, and other factors. But I do think that having a much more concerted and concrete effort related to those other areas will allow, I think, as you're exactly saying, health officials to be also clear about the trade-offs that they're making. I mean, I'll tell you, for example, with the schools issues, we had to consistently, make the point, in our press conferences that controlling, COVID in schools is not the only priority, that there are other health benefits to being in school that need to be weighed against that. But at the same time, our inability to have quantitative metrics and say that, if we reduce, infections to this level, we'll gain X percentage points in
right.
Educational learning. It just becomes much more challenging. It becomes seen as a value statement only, as opposed to a balancing of harms and benefits in a strict quantitative way.
Interesting. I mean, in the end, what it sounds like you're saying in part is that we have to recognize that there are factors beyond the data that are actually quite important to decision-making. At the same time, the more data we can bring to that, maybe the better those decisions can be made.
It's been incredibly challenging, I think, for all of us as health officials to live in this world where, first of all, the information is changing constantly. So even when we say we want to follow the science, we also have to be ready to pivot immediately and say, well, actually, what we thought was true now is actually not so true. And even when we've been very good about couching our uncertainty and that our opinions may change, we face that challenge all the time. So information is moving at a very dramatic pace. So, following the science is almost like chasing the science, right? But then the second half is that difficulty that we face right there about how do we be much more clear so that people understand that we recognize that what we're doing is a little bit less than what you might want to do if your goal was zero COVID. But it's what we can balance between when we have to measure all of the harms and benefits.
Well, Dr. Varma, thank you so much for this conversation today.
Great. I appreciate you having me, Josh.
Public Health On Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.